Are you thinking about getting Botox? Celebrities swear by it. Seems like everyone's doing preventative Botox nowadays, but is it right for you? Before you jump into it, you should consider what is it that you're trying to accomplish, and is this something that you're really going to benefit from? Just because everyone else is doing it doesn't mean you have to. Hi, I'm Dr. Brown. I'm a board-certified medical and cosmetic dermatologist, and as you're about to hear, even though I inject a lot of Botox, I don't think it's for everyone, and I do often think that it's overdone just a little bit. And full transparency, I'm in my 40s. I have been getting Botox for quite some time. I think I started when I was 27, not by choice. I was kind of made to do it. You're gonna think how that happened, but it did. And then I went, gosh, 4 or 5 years without getting any pregnancy breastfeeding and things like that. So have I had it? Yeah. Is it in there now? Yep, it's wearing off a little bit, but I do it a lot. And I have patients who come in, they just want to be frozen, and I have others who maybe should treat areas or they don't want to. It's not cookie cutter. It's not everyone should do it. So let's dive in. Is it right for you? And how do you know? Botox has become so popular to the point that everyone seems to think they have to have it, especially early on. I have several 20-some-year-olds who are coming in thinking that they need Botox. Now, some sure would benefit, but there's so many that don't need it. So you really need to think about, what are you trying to accomplish? And is this really right for you? And find the injector that is listening to you and is going to do whatever it takes to help you change what's bothering you, not just do Botox because that's what you asked for. Today we're going to talk about some reasons not to get Botox and some intricacies of where you might want to get more or less Botox depending on your facial features. Now, out of curiosity, comment below if you've had it done. I'm just curious, or if you love it or hate it. I'm just always curious what everyone thinks about it. Now, for the purpose of the video, I'm going to keep saying Botox. By that, I mean a neuromodulator. Dermatologists, plastic surgeons, and in medicine, we call these neuromodulators, meaning these are substances that are, when injected, slow down the muscle movement. So they don't make the lines go away, they just slow down the movement that's creating the line. Therefore, if maintained, the line will slow down over time, or the line will become less apparent over time. And when I say Botox, there are 5 different brands on the market. There's Botox, Dysport, Daxxify, Jeuveau, Xeomin. I've had most of them. One's not better than the other. There are certain situations where you might prefer one over the other. Every good injector should have at least 2, just because human bodies are not all the same. We all react differently. We metabolize it differently. We have different facial features, so sometimes tweaking it just a little bit to get certain things is important, and therefore having at least 2 different neuromodulators in the office is extremely important in my opinion. Most people want to get Botox done if they're developing lines that they want to have treated. So if you raise your brows and you're starting to see some lines, or if you scrunch together, you see 11s here, and those are appropriate areas and very appropriate treatments. So if you're just starting to see those lines, Botox is your jam. Now, there are some patients who, when they smile, maybe one side of the mouth pulls further than the other. When they scrunch the nose and make bunny lines, maybe one's stronger than the other. When they smile, maybe they pull one brow down more than the other. Those are things that are genetic. Some people are just born like that. There's also patients from traumatic brain injuries that end up with one side of the face that's different than the other. These are overall asymmetries, whether genetic or from trauma or injury, and they can be treated with Botox. You don't have to start seeing a line where your lip pulls down to come in and do Botox. So if you're looking at yourself in the mirror and you're seeing asymmetry, particularly with facial movement, such as if you smile or raise your brows, if one side is moving more than the other, Botox is excellent for this. You can inject the Botox on the side that moves more and make it more symmetrical to the side that doesn't have as much movement. I have successfully treated several patients with either genetically inherited facial symmetries or from traumatic brain injuries, and it has been so rewarding for them. So if this is you, please see an experienced injector because we can help. And typically for these things, it requires just a few units because you're not treating a big area. You're just trying to get that lip to pop up a little bit more, or you're trying to get that gummy smile to drop down a little bit. Or if you have Bell's palsy and one side is completely flat and the other one's so high, you can lower the unaffected side. So make sure you let your injector know, or reach out to a dermatologist or plastic surgeon if these are your concerns, because we can certainly help and get you that confidence back. There's certain instances where Botox is just not suitable for you. One of my reasons that it's not suitable is I want it for preventative reasons. There is no such a thing as preventative Botox. If you don't have a line on your forehead, there's no point in adding Botox there. Botox might be ideal to treat forehead when you start to see those tiny little lines and you're already using your retinol and sunscreen and vitamin C, not just because you don't want to get those lines. I'm a firm believer in muscle movement so that over time your face looks as natural as possible. If you freeze your forehead muscle from age 20 all the way to age 60 and you never allow it to move, it's probably going to atrophy a little bit. What that means is it's going to thin out. That's not a good look. It's not a youthful look. It's an old look. If you overdo Botox, particularly in your forehead, and you start early and you keep it frozen over and over again, mark my words, you will look older than your peers who let the forehead wear off a little bit, or maybe those who started a little bit later. So enjoy the movement that you have in the forehead. Don't look for the frozen look. It's not a good look. It's not a natural look. It shouldn't be a look. So this is one of my biggest pet peeves where somebody comes in, they want it done just because so-and-so is doing it. Everyone's facial features are different. Don't get caught up in keeping up with the Joneses. You do you. Just because somebody else is doing Botox and they love it doesn't mean you need it. Also, if you're not the one who's doing the Botox, don't judge those who are. We all get to decide for ourselves. Now, when you decide to do Botox, I find it extremely important to find the right injector. I have so many patients who come in and they want something fixed and they think Botox is gonna get it done, and that's not the case. Maybe they needed filler or microneedling or just skincare. Just because you think you need Botox doesn't mean you actually need it. It's important to understand and find an injector who will listen to you, understand what is it that you're trying to correct to regain that confidence that you feel like you've lost, and then do that procedure, not just do the procedure that you think you need. Another great reason not to do Botox is pregnancy. If you're pregnant, you're growing another human body. There's no reason to be doing cosmetic elective procedures. Studies are really just not done on pregnant women because it's unethical. Not to say that Botox isn't safe during pregnancy, it's just not studied and in my opinion should not be done. Let that human body grow. When it's on its own, then do what you want with your body. But when you're pregnant, defer all elective Botox injections. Now let's say you've decided to do Botox and you are a good candidate because you have lines that are created by muscle movement. Botox minimizes the appearance of the lines created by muscle movement. For example, if you scrunch together, you form the lines here. Botox is great in here because it will paralyze the muscles that scrunch together. Therefore, the lines that are created by that movement will be minimized. Now, if you have deep lines on the forehead, that could be a few reasons. It could be that you raise your brows a lot. I know I do that. It could be genetic. It could be that your eyelids are hooded. What that means is you have a little bit of extra skin right here. And as we get older, that becomes more prominent. That's genetic predetermination to having hooded eyelids, but can become more prominent as we get older. And then your body doesn't like that because you're trying to see and you constantly raise your brows. So when you're raising your brows, this frontalis muscle up here gets very active and creates these little lines up here, horizontal lines in your forehead. The way to treat that is to put Botox in there, but guess what happens? You put Botox in your forehead and suddenly that muscle that's been raising your brows is relaxed. And what happens to your brows? Boom. Down they go. That's not necessarily the look that you are going for, is it? No, nobody wants their eyes smaller and hooded. Nobody does. But you might not have thought about that when you decided to treat those forehead lines. I can't tell you how many times I've had a patient come in and say, well, I wanted the lines here treated, so they only put Botox up here. Well, it was too heavy. Yeah, you can't just treat this. And you can't put 20 units in the frontalis muscle up here just because that's what's on label. Because what happens is your brows drop and you end up with a flat brow. Nobody wants that. I mean, if you're a male and you're doing Botox in the frontalis, sure, 20 units might be appropriate, but I think I have yet to inject 20 units in the frontalis in a female. It's just not necessary. Does that mean you can't get Botox in your forehead if you have lines there? No, it definitely does not mean that. What it means is you should treat your glabellar region, which is your frown lines, because these muscles here, when they're activated, they scrunch down. If you paralyze them, the brows are going to lift a little bit. So now that you've lifted the brow, you have a little bit more wiggle room to put some Botox in your forehead, and then you can conservatively treat your forehead. Number of Botox units injected is directly proportional to the duration of the Botox. Let that sink in. What that means is that the more units you inject, the longer it's going to last. So should we just all inject a ton of units so it'll last 3 to 4 months? No, because what happens is Botox kicks in at like a 2-week mark, 10 days to 14 days, and that's the maximum efficacy. It kicks in and then it starts wearing off at about maybe week 4. I know it sounds sad, but it does a little bit, but that's your happy spot. That's when you have not a ton of movement, but it looks just very natural. By week 8 or 10 down here, it's wearing off a little bit and you're seeing movement at 10-week mark. And then by 12 weeks, you're ready to have it done. That's the majority of my patient. But the reason for that is because I'm conservative with the frontalis or the forehead muscle injections. If you overdo this, it's going to look really flat, feel very heavy, and look extremely unnatural. And I always tell my patients there's like 2 components to Botox. There's a medical side and there is the psychological side. So medical side is how many units do you need in that area for it to last 3 months? And then there's a psychological component that says, how do you really look when you get that many units done? In the upper face, we have 3 main areas that we inject. Right through here, when you scrunch down, you pull this down, so injecting here will help raise the brows. Psychological studies show that freezing this completely, if you never frown a day in your life, you can look just fine. As a matter of fact, those people tend to have more promotions, look happier, have more friends. Totally cool. Go for it. Now, the other 2 areas, like your forehead or around your eyes, if you can't raise your brows at all, or if you can, when you smile, you have no lines here, and you do what's on label there, you're going to be completely frozen. You're going to start looking a little fake. That is not a good look. Human eye, even untrained human eye, can detect those fake looks pretty quickly. You don't want that. You want to leave some movement in your forehead and around the eyes, because the second you do, and you paralyze that whole thing, you're going to look unnatural. The purpose of the Botox is to help you regain the confidence and take you back in time a little bit, not to make you look fake or frozen. So for the love of God, don't overdo it. Pick an injector that's conservative, that will see you back, that will touch it up if needed, not just freeze you and then you hate it or look weird. When discussing Botox and thinking about different brands, it's not that the others like Daxxify, Dysport, Xeomin, and Jeuveau are off-brand. They're just different brands. It's like Pepsi and Coke and Dr. Pepper. You either have a preference or you don't, or a certain restaurant only carries some. I personally carry Botox, Dysport, and Daxxify. I like having 3 options. I've had all 3 done. I can tell the difference, especially with Dysport and Daxxify. They kick in a little bit quicker for me, and Daxxify lasts quite a bit longer, especially in the lower face. But the type that you pick should be between you and your injector. One's not better than the other, and Botox is not the holy grail. There are others that may be better for you. Some things to look out. Okay, so you've decided Botox is your jam, you're gonna do this, even though maybe I said don't, or you wanna see if this is your thing. How do you pick an injector, and what are some red flags? First of all, Groupon. Don't Groupon your face, okay? This is a medical procedure. It is a neuromodulator, aka toxin. It's going into your face. Just don't Groupon your face. It's not worth it. Groupon your pedicure, not the face. Second, pick an injector who has maybe a little bit more experience. I personally would only have a physician inject. I'll probably get hate for this. I believe that they have more training. Medical school is 3 years, then there's residency training. Dermatology is 4 years. Plastic surgery is even longer than that, 6 or 7 years. Pick somebody who does this a lot. Pick somebody who, when you talk to them, you're comfortable with them. Pick somebody when you go to consultation and you look at their face, you're like, oh, yeah, they don't look like they've had anything done, but then you hear that they've had things done. That's probably a person. Now, if you go for your consultation and you are being sold on price, or you're feeling pressured, or you look at your injector and they look overdone in your opinion, that is too many red flags. Run. Some things I have heard from patients who have come to me from previous experiences that they've had other places are things like, I wanted my forehead lines treated and they were treated, but it was so heavy my eyes felt closed off for months. Another patient recently showed me a picture where they put her face into a machine and machine determined how many units should be injected and where. Those are just not things that should be done. Everyone's muscles are a little bit different, and machines shouldn't be determining how many units go where. Also, not all of us are symmetrical. I'm very asymmetrical. I inject a few more units on one side of my face than the other, and it's important to have an artistic eye when injecting, and not just a machine determining how many units go where. And remember, your Botox, Dysport, Daxxify, Xeomin, Jeuveau, whichever one you get done, isn't going to kick in right away. You're going to walk out of the office with tiny little dots on your face. They're going to last maybe 10 or 15 minutes, and when they go away for days, you're not going to notice anything. And then it kicks in anywhere from day 3 or 4 for Dysport and Daxxify up to day 10 to 14 for Botox. And when it's kicked in, that's when you should touch base with your injector if you're not seeing the results that you think you should be seeing. And if you had it done and you didn't love it at that 2-week mark, please call your injector. Maybe you needed more, maybe it was too much. And when it wears off, how are they supposed to know what to do in 3 months when it wears off if you didn't touch base with them at 2 weeks? All my patients know to call me 2 weeks after the injection if it's not absolutely perfect. If you're a first-time injector, I always have you come back in at 2 weeks just to touch base again, because you've had it done before maybe. I've done Botox many times, but you and I have not done this together. So making sure that we're on the same page as far as what you think was going to happen, what actually happened, do you think you need more or less units next time, is really important. And the best time to do that touch base visit is 2 weeks after you've been injected, about 2 to 4 weeks after you've been injected, so that we know what your desired look and units are for next time. Botox can be great. It is probably the highest, I call it, repeat offender rate in my practice, which means you've done it, you're going to keep doing it. And by that, I mean Botox, Dysport, and Daxxify. And patients have really good, excellent results. It's not for everyone. There are patients who need less than they think. There are others who might need a little bit more on one side, not the other. So it's important to have an injector who understands and doesn't overdo it. And look at your injector. If they're looking weird, you're probably going to look weird. Would you get Botox? If you haven't had it done, would you get it done? How did this video make you feel? Do you feel more confident, or are you just terrified right now? Let me know below. If you enjoyed this video, let me know in the comments if there's any other topics you want me to discuss. Also, I have shorter versions on TikTok and Instagram at Dr. Alexandra Brown, and that's Dr. Aleks, no X. Thanks for watching. Bye.